Since 1995, we've been taking medical mission to Nigeria and taking care of communities that have been neglected due to poor health care.
Take this once a day for your high blood pressure, okay? You take this for your cough at night.
We had the opportunity to be in Nigeria this year. This is the 19th year of our operation as a medical mission.
My name is Zina Salem, and I've been here in Nigeria now for almost 2 weeks on the medical mission. And honestly, the experience has been amazing. It's been surreal. I've always wanted to partake in a medical mission, and after I got this opportunity, I decided that this was something that I really wanted to do.
In the past 2 years, we have had a lot of issues because of the pandemic. And as a result, we did not go back to help those in need. And there were a lot of human toll. A lot of people lost their lives, as the pandemic was a global issue that impacted the world in general. More especially the countries that have been already marginalized, like Nigeria.
So being a new registered nurse, I definitely had to develop my clinical skills a lot quickly. We've seen hundreds of patients every day that dealt with a whole lot of various conditions, from diabetes to hypertension to various forms of infections, and a lot of patients dealt with pain all over their body. So just working with these people and trying to give them the care that they need was definitely beneficial for me as a clinician and to grow my skills.
As I come on Monday, so now they attend me immediately without any delaying. Now they come they treat the thing. I can't feel, they can't took me injection, I can't the feel pains. After some times, now the pains can't release.
Once we arrived, immediately I began to feel emotional about this experience. And then after the emotions begin to sort of settle in, you begin to focus on the job that we have to do, which is to care for people. One in which was a young man who had a bad bacterial infection which had grown throughout his foot and had caused several ulcers throughout his foot. And he's had this since 2019, and it had gone untreated. We cared for him, we treated his wound, we dressed his wound, we cleansed his wound, we debrided his wound. And I have to say, I have never seen a wound that bad.
I've gone on trips for a week's time, but being immersed in a culture and being able to give back the way that we have has just really shifted my mindset on nursing, on humanity, on healthcare, and I've really enjoyed it.
My purpose of coming here is to come and take drugs for waist pain and headache.
I am really passionate about global health. I believe that what happens in other countries affects the entire world, and so we all have to do our part to take care of the health of our community. This is actually my 6th medical mission. I have been to Ghana, I have also been to Haiti, but this is my first time in Nigeria. It really has been such an amazing experience here with NHF and Dr. Obollo and the entire team.
We used a center that is not our own yet, because we're working to make sure we have a place that will have a continuity of care. And this is one of our vision, to have a center.
when you look into their eyes, you see your children. When you look into their eyes, you see your mother, you see your grandmother, and you would not want to see your loved ones in those conditions.
We've seen some patients come in who've had really bad wounds, and we help to dress those wounds and to make them better. And to see them come back a few days later, so appreciative and so grateful and so happy to have us here.
So then don't remove the medicine where they put before, come put new one now. So the face can't change than before. So I don't feel normal small now. So I thank God.
I thank each and every one that has helped us over the years. All my wish is for God to continue to bless each and every one that has helped us to make this organization functional. Thank you so much.